Does this mean, Keith, I'm supposed to go ahead now?
Peter, why don't you wait another minute just to
Okay.
let some people log on? Thank you, Peter. Okay, Peter, why don't you go ahead? Why don't you go ahead with starting the introduction? Thank you.
Okay. Well, welcome everybody. I hope those slides we gave you at the beginning give you some flavor for the process of the negotiations that occurred just a few weeks ago. Just want to begin by saying, well, I'm Peter Orris from Occupational Environmental Medicine. I want to thank Dean Giles and the Global Program for allowing me the privilege of introducing this report on this strategic approach to international chemicals management meeting in Bonn, Germany last month, and the report to be given by Dr. Anita Breyer. This process in which we've been participating in for about 25 years now is particularly important at this moment in history, when we have such a heavy use of our advances in science and engineering by countries and communities who are hell-bent on slaughtering their neighbors. This convention stands out as an inclusive consensus process of humans on a global scale to eliminate harm caused by chemicals designed by engineers without regard to health. US, Iran, India, Pakistan, Ukraine, Russia, side by side, talking about how to solve these problems, and in general, civilly. And let me go on to say Dr. Anita Breyer her academic journey began with studies in economics at the University of Kiel in Germany. Then, though spending only a few years here with us at the University of Illinois, and it should be added in another department in Urbana-Champaign, we claim her as our own as she earned her master's degree in economics here. She returned then to Europe and received her PhD in 1989, and since 1990, she has worked for the Federal Ministry of the Environment, which has an extraordinarily larger portfolio than that, but I'll leave it just at the environment for now. Since 2020, she served as Director General for Chemical Safety, Emission Control, and Transport, and this month has been elected President of the Framework on Chemicals Process Itself, which is the new name for the strategic approach to international chemicals management. She mothered, if you will, the process of the most unusual negotiations that I have ever sat in on to a successful conclusion in Bonn, as I said, but a few weeks ago. And we're very excited that she's able to spend this hour with us, and I appreciate your coming. So it's all yours now, and we'll take questions at the end.
Yes. Thank you, Peter. Thank you for the kind introduction, and thank you for having me. It's really a great pleasure for me to be back at the University of Illinois, that I enjoyed very much staying there for 2 years and doing my master's. And yeah, thank you for taking me on and inviting me to this session. Today, I would like to introduce a bit what did we do at the 5th World Chemical Conference in Bonn in September 2023, and where did we come from? So I start with, yes, the question is, what have we achieved? What remains to be done? But I want to start with, where do we come from? So please, next slide. As Peter already mentioned, the process is quite a long process. It started about 21 years ago, and that was the Strategic Approach on International Chemical Management, SAICM. It was an international non-binding policy framework, and it was unique in the sense that it's not only governments, but it's also NGOs, civil society, industry participating in these negotiations. It's based on the 2002 Johannesburg Plan of Implementation of the Sustainable Development Goals. There we have a goal that calls for chemicals to achieve by 2020 that chemicals are used and produced in ways that lead to the minimization of adverse effects on human health and the environment. And we were very honest in saying we did not fulfill that, certainly not. And actually, it was already worked on that in 2024. In 2014, we realized that we will not achieve this. But let me come back first to the establishment of the strategic approach, because one thing that was really essential there was the Dubai Declaration, adopted by ministers, heads of delegations, representatives of civil society and private sector. That was kind of the starting point for this strategic approach on international chemical management, SAICM. And as you can read here, it was adopted at the International Conference on Chemicals Management in Dubai 2006. So there it started. And there we kind of reaffirmed the aim to, or the goal to say, we achieve by 2020 that chemicals are used and produced in ways that lead to the minimization of adverse effects on human health and the environment. So in 2014, 2015, we realized we will not be able to get there. So we have to reaffirm our goal and to reestablish our approach. Well, if you have an approach that aims at something to be reached at 2020, and if you see you will not achieve it, so you have to change something. That's why we had this saying of beyond 2020. What do we do beyond 2020? But let me first turn to, where do we start? What is the problem? Next slide, please. What means 2020 goal is not fulfilled? For this, I just show you some pictures and you know what I mean. We do have highly hazardous pesticides around. The textile industry is not working everywhere on sound grounds. We do have severe waste problems, waste dumps that are not safe, and people suffer from chemicals that they are exposed to and that do harm to their health. Next slide, please. So the status was worked on by the so-called Global Chemicals Outlook 2 that was published in 2019, I think, 2018, 2019. And there we learned, in order to evaluate the situation and where we are. And there we can read that doubling of chemical sales is expected for the time period from 2017 to 2030, after already production having been doubled between 2000 and 2017. So we do have a severe increase in chemical production and use. Okay, lots of chemicals are very helpful. We need them for transition to a sustainable world, for a climate-free, a climate-safe world. and of course in lots of technological approaches. But, and that's the other side of the coin, WHO in 2018 reported that we have 1.6 million premature deaths by chemicals in 2016. And just as an example, the World Bank this year drafted a report for us on lead, for example, where they found out it's 5.5 million premature deaths by lead pollution in 2019. The costs of health effects by lead pollution amount up to 10.3 trillion US dollars, or 7.76% of the world's gross domestic product. 1/3 of all children worldwide contaminated with too high blood levels of lead, which, as you probably know much better than I, results in neurological effects and just robs kids of their chances of a good and safe development and growing up healthy. And of course, the most of these effects are hit most or occur most in middle and low income countries. So there's a very strong social component attached to this as well. Okay, so that's the background on which we worked. And next slide, please. Then we had the plan to have a beyond 2020, something beyond 2020 by 2020, of course. But the pandemic, of course, hindered us to meet in negotiations. We managed to keep it up a little bit by meeting virtually and having groups virtually, but processes like these will not work, at least in my imagination, unless you really come together for a couple of days, for a week or two, and really try to forge it out. And we did. We did in Bonn, my hometown, where I'm sitting right now, and having there the 5th World Chemical Conference under the presidency of Germany. And that means I had the honor to be the president of this process. And there we adopted the global framework on chemicals for a planet free of harm from chemicals and waste. So that was already one very important issue of the negotiations, how to name it. And that's the name we found, and I'm very proud of this name as well. So the global framework we adopted the global framework early in the morning of the last day. And with the global framework on chemicals, we also had 12 resolutions for implementation arrangements, and we adopted a global framework on chemicals fund to finance implementation, especially in those countries that are in need of assistance. So we were very happy and glad that we managed to do that. And including of the decisions we took was also a high-level Bonn Declaration for a planet free of harm from chemicals and waste, which was adopted by ministers, heads of delegation, and stakeholder leaders. So that's industry and NGOs and health and labor people all together agreed on this. And probably let me read to you the really very first paragraph of the Bonn Declaration as an example. And that runs as follows. Pollution is the world's largest risk factor for disease and premature death, with pollution from chemicals contributing to millions of deaths, illnesses, and disabilities each year. So it was the biggest achievement really, I think, is to pinpoint this, to name this, and to have a global statement and reassure the world one more time that we do have to work on this issue. We have a responsibility to do that and to show to the world what that means, in which directions we do have to work. Next slide, please. So what have we achieved? We have 5 strategic objectives with 28 concrete sub-targets. Let me run through the strategic objectives that we agreed upon in the framework. And this, the first strategic objective is legal frameworks, institutional mechanisms, and capacity in place. What does that mean? What are the pictures behind it? Well, in order to save lives, to save the environment, we do need rules in order to handle chemicals well. That is something like making sure that farm workers in the agricultural sector are protected from highly hazardous pesticides and pesticides by, on the one hand, probably not using the highly hazardous ones, but using ones that are not as hazardous. And by making sure that these farm workers do have sufficient protection when applying these pesticides to the field. It also means that we need legal frameworks to ensure that products that are hazardous do not come to the market, or if they come to the market, are taken care of so that consumers cannot harm themselves. And once they become waste, they need to be treated well, not in dump sites as you have seen those in the pictures that I shown some minutes ago. So for this, we do need legal frameworks, institutional mechanisms, and capacity in place. That is the urgent need we have. And knowing from our global chemical outlook, it's about 100 countries certainly do not have a sufficient system in the world. About 100 countries do not have sufficient systems in the world to, give labels to products if they are dangerous. Just saying, keep it away from your eyes or keep it away from your children. Little things like that. But we do still have to work on that. The second strategic objective addresses sufficient knowledge, data, and information available. Of course, if you want to have a legal framework, institutional mechanism, you do need to know what products do you have, what risks are there, whom to protect, where are the dangers. Is it rather on the side of production sites, or is it rather where the use has been done, or is it in the waste stage? You need to know that. So that's the second strategic objective. The third strategic objective is issues of concern identified, prioritized, and addressed. So that means make sure that you know what's up in your country, make sure what is up in your company, because it relates to industry again. Make sure that you see where you have to act. The fourth strategic objective refers to safer alternatives and innovative and sustainable solutions. That, for me, is a very key objective in our framework, because it means that we have to design and use chemicals wisely. Think about whether a certain chemical, which might do a great job on a specific task, is really safe enough to use it. Where does it end up? Does it end up in the blood of an ice bear? Then you better think about how to handle the issue in a different way. And look for other chemicals that might be doing the job as well, but have much less harm than the ones you have. And that very much lies on the responsibility, of course, of industry, of science, of all those minds that are able to think about what to do. So it's calling on chemists and, of course, of downstream users, production sites to think about, well, do I really need to use this chemical for producing my product X and Y, or can I do it in a safer way if I just use something else? So here really, I think, is where we get the shift to transform our chemical sector, to reduce our chemical footprint to the world. And finally, the fifth strategic objective, of course, is resource mobilization, cooperation, partnerships, capacity building. And I would like to stress resource mobilization means, of course, external funds, but also it means if you set up a legal framework and if you want to handle in a country chemical safety well, then you have to take care that you have some system of fees or taxes or whatever in order to generate the funds that you need in order to pay for those people who do the implementation of these processes. Down here on the slide, I also have the link to the internet site where it's called SAICM here, although we shift our name now to the Global Framework on Chemicals for a planet free of harm from chemicals and waste. We have here the internet page where you will find finally the texts of the framework and of the Bonn Declaration and of the resolution, so that you can yourself read what we agreed upon. But we are still in the process of editing and translating the text. So currently you will only see that we are working on it and what kind of documents there will be very soon to come. Okay, next slide, please. So also what we, as I already mentioned a bit, we do have packages with measures for implementation. We have arrangement to finance implementation and for capacity building. And we have arrangements for monitoring of progress. And we enable the cross-sectoral cooperation of relevant stakeholders. Because of course, having objectives and the targets that do tell you what is our aim is not sufficient. You need, for example, take care of the process. Do we make progress? We will take care and have reporting from all stakeholders here and see how progress is running and making everyone a bit more responsible to really achieve that progress. I don't know if I mentioned already, we are not legally binding. This is not a convention. It's just an appeal to the world that we need to change something, a little bit like you have that with the Sustainable Development Goals. They are not conventions, they are not legally binding, but it's a promise to the world from a broad community. All stakeholders have agreed on that we do have to change things here. So amongst the measures for implementation, for example, a very important one is that we do call on, or we do establish a highly hazardous pesticides alliance to phase out highly hazardous pesticides. That is really a big problem because these highly hazardous pesticides are still used very much in lots of countries, even exported by countries who banned them by themselves because they are so hazardous, and we do have alternatives. So with this alliance, we want to have a worldwide global dialogue in order to achieve getting out of these highly hazardous pesticides, and also trying to ban or to get out of exporting products, chemicals from one country to other countries if these chemicals are not even allowed to be used in the exporting country. So we do name quite some of the issues that have to be changed within these objectives, targets, and in the measures of implementation, trying to take action, making everyone cooperate on these issues. Okay, next slide. What remains to be done? While we are very proud, and it takes if after these negotiations, everyone was very, very exhausted because we worked very, very long and very intensely. It takes a while until you realize, well, was it really good what we decided upon? And it was good. It is good what we have. It is a strong signal to the world. But what remains to be done? Of course, we do need to develop these legal and institutional frames and capacities in many countries. And actually, I would say in all countries. In some countries, we do have a very good basis, and I would claim that Germany does have a good basis, and I know the United States have a good basis. But if you look at it, if you think, are we really apt to this standard, that we do reduce our chemical footprints and that we do have a transformation of the chemical industry, we should not be too proud on what we have. We have to continue working in our countries as well in order to get there, having safe and sustainable by design chemicals produced and used. Also, what remains to be done, of course, is we have to fill the new global framework on chemicals fund for financing and capacity building. There is some money in there already, but of course, we hope for lots of other ones paying in there. Then also we have to explore other means of implementations like partnerships, technical support, information exchange, which is already ongoing. Under SAICM, we did have things like that going on. But of course, in order to tackle the task, to really go for a transformation with respect to the chemical sector, we need to continue doing that and need to continue exchanging good ideas, learning from each other how to advance chemical safety and safety of waste as well, in all respects. So implementation. We have to go ahead and convince all of our policy leaders and finance ministers and economics ministers and industries to go and work for this with urgency. Also, one of our goals is that we want to bring the chemicals and waste agenda to UNEA 6, that is the United Nations Environment Assembly 6, that is next year or the year after. I think it's next year that we have UNEA 6. It's only every 2 years. And we want to bring it also to the United Nations General Assembly, because that raises our profile and makes all those beyond our environment, health, chemicals sector people be more aware. And you cannot have chemical safety unless everyone is working on it. It's a bit like with climate change as well. You cannot fight climate change if you only look at one sector. All sectors are in there and they all have to reflect how to reduce their chemical footprint. Yeah, and next slide, please. Thank you for your attention. And I'm here and looking forward to any questions that you might have, and hope that I could help you understand a bit better what we did here in Bonn. Thank you.
Thank you. And I neglected to mention at the beginning, please place your, excuse me, questions into the chat. We have an initial one from Allison. I have a whole set of them, but we have an initial one from Allison. When developing the 5 objectives and the 28 sub-targets, what were the biggest sticking points and the hardest aspects to gain consensus on? In other words, give us a little gossip from the meeting.
Yes, certainly. Actually, that we had 2 targets that were discussed right into the last night. And that was the one target was the one on the highly hazardous pesticides. Because, of course, there are enough interest in the room, those who produce highly hazardous pesticides, countries who still produce highly hazardous pesticides, were reluctant to say, okay, we really want to get out of highly hazardous pesticides. And I do admit we do have the target with 2035 on highly hazardous pesticides, and some adjectives like or some weakening words in here that say, wait a second. Yeah, by 2035, stakeholders have taken effective measures to phase out highly hazardous pesticides in agriculture, where the risks have not been managed and where safer and affordable alternatives are available. So you see, as in these international negotiations, you do have some terms that make it a bit weaker, a bit softer. But I think the language is clear enough to show that we, the world, the leaders, those who were participating in negotiations know this is a problem on our agenda, and we have to tackle it. Another one that was quite difficult was also the one I also referred before on exports. The idea that please do not export things where you think for your country it's on health grounds it's not safe enough. And there again we could find have a compromise by making it a bit softer and aspiring to things like that. But still, you see that we are addressing this point. We do have to tackle the issue of exports of products that in your own country you think it's not safe to handle them. So that were the 2 targets that really were open until late at night or early morning in Bonn in the last negotiation night.
Cool. Now let me get to my hard talk questions.
Yes.
As you said, this is not an enforceable treaty, quote unquote. It is rather a consensus document and a consensus aspirational situation, if you will. How does this move ahead? I know you've met with stakeholders over the last year of all aspects, industry, NGOs, etc. What are the driving forces that can move this ahead? We in this country are, to say somewhat frustrated with industry would be an understatement related to that.
Yes.
So why will this be successful rather than just a weekend in Bonn?
Yes. Well, I think the strength of those kind of negotiations, frameworks, agreements rests, of course, on the moral side. And So I think most countries and stakeholders will not want to be named that they are not taking care of what is written in here. If you have clear language in there that people understand, and if you can hold them accountable, if you have a measurability structure that we still have to develop that makes you able to blame and shame people. At least my understanding and the way that, for example, industry on the negotiations participated, they do not feel comfortable if you can show, well, you are not complying with this. Of course, there will be always these discussions on, well, but we did it, and then other ones say, no, that's not enough that you did, it's too slow, it's only halfway, etc., etc. Yes, but that's the way we have to proceed. I mean, it's progress is a snail, we say sometimes in Germany. It's you have to be patient and pushing it ahead, but it's one step after the other. And as I said, it's if you have good arguments like these, people will not be claimed to be not fulfilling this. I still am optimistic on that one.
I too. We have a question getting to one of the points that was handled by implication rather than proclamation, if you will, in the final document. In public health, we tend to work based on the precautionary principle, but most chemical companies, with the aid of governments and regulations, function based on the principle of okay until proving harmful. So shifting the burden of proof for corporations is a big challenge. How can we best tackle this? What have you seen in your experience?
Yes, that's a very good question. The issue of precautionary principle that is rather firmly implemented in environment thinking is very difficult to use in the chemical sectors. I fully agree on that. So the question is really very well put. Because it is very difficult to know enough about a chemical so that you can well sufficiently well use the precautionary principle. I mean, of course, the easiest way would say, well, if I don't know what it does and where it ends, does it end in the ice bear? And what happens if the ice bear dies? So then we just rule it all out. That is a too strong way of handling chemicals. We do need chemicals and we can use them. And even if we do not have all knowledge about it, I think there's no way that we can, rule out all risks. What I think is very important on this issue is, and the way we tackle it within the global framework, is by asking for data and information. The more data and information we have, the easier it is to act speedily, to act on a level of not having, of course, it's not changing the burden of proof. But it's helping us to decide. So industry did commit in Bonn to issue more information on their chemicals by now. I don't know the date, what they said. I don't know. I think it was 2030, something like that. So that is a step forward. I think it's this double way of we need more information that will help us to work better on what is harmful, what is not harmful, where is the level where we need to prohibit things or to prohibit, for example, it in consumer products, etc. So yes, good question.
So let me ask for young people who are getting training now and moving into the field from a public health point of view. Obviously, public health wise and scientifically, we perform an important task of making the invisible visible, because it's so hard to identify the cause of some of the chronic diseases we're concerned about. On the other hand, there is a degree of parochialism, if you will, between ministries and in different countries, etc. So on a practical level, somebody coming out of public health, how would they get involved in this kind of activity on an international level, setting international health policy, when SciComm is, in general, a representation of the environment ministries, if you will? How do we get the health ministries more involved?
Yes, that's a good question as well. We are trying to really show the health impacts on what happens with the chemicals, and we definitely need your support from the health side, me being from the environment side. I'm not sure how really we can bridge that gap well. For the environment side, it would be very, very helpful if the health side would be more active in asking us to be more active, to be more successful. Because, of course, if you're on the environment side and if you're working on issues like this, you often, or it's easy to hear those who have to change something, that it is too difficult and that you have lots of problems if you have to change the way you handle things. And okay, then we, the environment people, say, well, you protect the environment and you protect human health. And then those might say, yeah, but I don't hear from the health people about this. And I do have a little bit the impression, I don't know, probably it's different countries, but that the health sector is very much oriented on, for good reasons, on making sick people healthy. And what we are trying here, what we need is primary prevention of illnesses, of diseases, and that is not always and everywhere really so classical part of health, at least the way I recognize or I hear interventions from health people. So yes, we do need your help, and I'm very happy if probably even with this talk tonight we can inspire some of you to concentrate your work on this issue. I can't hear you.
No, well, I can keep
okay.
going. I
Yeah.
was just looking to see if there was something else. Well, let's ask now, what about mid-career people? And the opaqueness of the GEF, if you will, with respect to the ability to fund small projects, not through governments at several levels of approval, etc. Are there practical plans, and what is the kind of research that the global framework will be looking at? One assumes it's not basic what the chemical cause is or what's the health impact, but rather more educational or policy issues. So,
Yes.
but that's from the outside. What has the thinking been about the ability of educational institutions to tap into some resources that would be useful for the framework?
Again, a good question that I don't have a real answer for, because of course the central focus of the instrument is really to help establishing frameworks, to help to establish legal rules, to help establish institutions that take care of the issues that I talked about, and by exchanging knowledge on that, we do have a support for the science policy panel in our Bonn Declaration. I don't know exactly whether it's in the framework itself, but at least in the Bonn Declaration, we call on this support for the science policy panel. That is, I don't know if everyone knows, at UNEA, United Nations Environment Assembly, it was decided that we should have a scientific council for chemical issues. And this chemical council is something like, probably the more famous brothers and sisters, that's the IPCC, so that's the Climate Council, and the one IPBES for biological, for biodiversity. And our idea is that we would certainly need an institution like that doing scientific proof of what's the problem, where are the problems, and giving us indications where are we lacking in our management of chemicals. I don't know whether, well, currently the negotiations are going on to establish such a panel, giving it a nice name, because I think science policy panel is not the right word for it, but probably they will find one. And I do hope that by this we can, inspire more scientific research on the broader issue, and certainly the health issue will be an important one in there. I'm sure. So probably there we will find a way to make projects, smaller projects that are more scientific oriented to get them or give them a home there, and a possibility to even get funded.
I think we're talking them out. That last point, though, I want to underline, especially for senior researchers and others in our institution. We're one of the few institutions in schools of public health that spends the kind of time on environmental exposures and has a publication history. And they've only had a meeting and a half, or going on 2 meetings, to begin to organize this type of panel. And anybody on the line that would be interested, this is a very important place to be, to assure independence and a balanced approach to many of these questions. So I will give you a few minutes to wind up if you would like.
Okay. Yes. Thank you. It's really a pleasure to be in Chicago, at least virtually, and at the U of I. And I'm very happy to be able to reach out to you on this issue, and hope that I could inspire some of you to continue following us and continue pushing us, and hope that wherever you might go in your professional careers, the younger ones probably just being on the verge of going out, that you check there what and where and what and how to work for a planet free from harm of chemicals and waste, because I'm sure you will find a place, even if it's only at home, and you check what stuff you have in your kitchen or in your where you have your cleaning tools, and check how to improve our chemical footprint. Thank you.
And thank you very much for joining us, and we recognize this is a very particularly busy time for you. And really appreciate that you've been able to spend this time with us. Anybody interested in follow-up? Alice and Keith, myself from the global program would be very interested in helping you make contacts and move ahead. And I'm sure Dr. Breyer will be also in her office interested in helping more people in the field. So I thank you again, and I think we'll call it then for the day. Thanks.
Yeah. Thank you. Bye-bye, and have a nice day.
Bye-bye.
Thank you so much, Dr. Breyer. Thank you.